if we actually make cancer incidence in each country reaches 4 cases per 100,000 women per year, we will reach the elimination of cervical cancer as a public health problem.
So, hi Maribel, great to meet you. Where in the world are you at right now?
I am in Lyon, France, because I work for the International Agency for Research on Cancer, and the office is based here in Lyon.
Okay. Can you tell me a little bit more about the organization? Well, what do you guys do?
Yeah, so the International Agency for Research on Cancer is part of the World Health Organization, but is the independent agency that conducts research on cancer, particularly to prevent cancer.
So today we're going to talk a little bit about the HPV virus and HPV vaccines and cervical cancer. And yeah, could you start by telling me a little bit more about kind of how this all works together?
So the human papilloma virus, HPV, as we know it, is a virus that is extremely common in all populations. Our own immune system, we have a capacity to actually get the virus and get the virus out of ourselves. However, there is a small proportion, particularly a small proportion of women in whom the virus will stay. Then they may actually produce changes on the cells of the cervix. When those changes are made is when eventually, like depending on some years, there would be a lesion, what we call a lesion in the cervix, which could be a precancerous lesion. Years later, about 20 years later, these lesions may turn out to be a cervical cancer. So we know all these steps.
There is a vaccine, right, for this? And is that vaccine effective even after you've already contracted the virus?
Okay, let's speak about the vaccine. So when I say that we have a tool to actually prevent the infection, that is the vaccine. Currently, we have 3 types of vaccines that actually protect you against getting the virus. So, but for that to happen, the vaccines are more effective if that happens before exposure. And this is why there is currently worldwide recommendation to vaccinate girls between 9 and 14 years of age, because we expect that these girls have not yet been exposed to the virus, right? If we vaccinate at that age, the protection is almost 100%.
So is there any way to test for the virus if you have gotten it and you're not vaccinated?
Exactly. So there is the other tool that we call screening. In early years, since the 1940s or 50s, there was one tool to do a screening, which is called the Papa-Nicolau test, as it was established that HPV is the main cause of cervical cancer. Then, let's say, science started developing a tool, all tools related to this virus, to stop the virus. So there is a detection technique for HPV. So we can detect HPV on the cells collected from the cervix of a woman.
So Maribel, do you have any specific data from the European region regarding cervical cancer?
Yes, I have to say that in Europe, we've been really lucky to have countries which for over decades have had organized screening programs. So these have been the countries that have led the world to where we are now. Having an organized screening program means that anybody that is in the target population, as I said before, like if you want to target women for HPV, for screening, you actually look for women 30 years and older. So it has been amazing, I think, that in Europe, in all these countries that I mentioned, this has worked for decades now. And you could see the reduction that has happened on cervical cancers in Europe is a very strike reduction on the incidence and mortality from cervical cancer. And I think there is a lot of collaboration between countries, and I'm sure in Europe, in the whole Europe, we should get to reduce cancer and eventually eliminate cancer as a public health problem first than in other regions.
So is it really true that cervical cancer really could be eliminated?
The WHO has established, revising the evidence, summarizing the evidence, that if we actually make that all cervical cancer incidence in each country reaches 4 cases per 100,000 women per year, we will reach the elimination of cervical cancer as a public health problem. So we have to actually try to get 90% of girls between 9 and 14 years vaccinated against HPV, as mentioned before, 70% of women over 30 years to be screened with a high-performance test at least twice in life by age 45, and 90% of women who test positive treated for these precancerous lesions, and any woman in the world that has cervical cancer to be adequately managed and treated until she gets rid of this cancer or improve her quality of life further on. So I think we can do it. Will take time, will take decades, but we will get there.
For sure. Hey, this is amazing news. Thank you so much for telling me all this. And yeah, thank you so much, and keep up your amazing work to beat cancer.
Thank you very much.